Planned Parenthood is an organization that provides women the information and care that they need to live strong, healthy lives. It is a trusted care provider, an informed educator, a passionate advocate, and a global partner that helps similar organizations all over the world. It delivers vital reproductive health care, sex education, and information to millions of people worldwide. According to their website, the heart of the organization is the local community. They have over 56 locally governed affiliates nationwide that operate nearly 650 health centers reflecting the diverse needs of each specific community. These health centers provide a wide range of safe, reliable health care, the majority being preventative primary care. They are a respected leader in educating Americans about reproductive and sexual health and providing comprehensive sex education that empowers all people to make informed choices and lead healthy lives. Their programs reach around 1.5 million young people and adults each year. The government is the largest source of funding for Planned Parenthood. In 2015, they received $553.7 million in funding from the Government Health Service grants and reimbursements, being around 40% of its annual budget. The term defunding has emerged to encompass the many ways that Congress can cut off this support. Republicans are targeting Planned Parenthood's ability to receive Medicaid reimbursements, which account for about 75% of the government support that Planned Parenthood receives. The money that they accept in Medicaid works to provide essential health care such as STI testing and treatment, cancer screenings, pap smears, contraception, and more to low-income patients. After they provide these services, they submit a claim to Medicaid for reimbursement, just like any other healthcare provider that accepts Medicaid. The vast majority, around 79% of Planned Parenthood healthcare patients have incomes at or below the federal poverty level, and Planned Parenthood is often the place they can go. Without convenient and affordable access to reproductive health services and family planning, a variety of rates go up, including unplanned pregnancies, maternal and infant mortality rates, incidences of unsafe and self-induced abortions, and STI rates. Dawn Lagoons, Planned Parenthood's executive vice president, stated that the intent here is to destroy Planned Parenthood, not just because we do these particular services, but because we are a champion of one of the most radical ideas in history, that a woman's body is her own.
My body, my choice. My body, my choice. My body, my choice.
Planned Parenthood is working to harness the post-election and inauguration energy and outrage into political activism, calling on supporters to participate in rallies and protests, make donations, sign petitions, canvass in communities, call politicians, and volunteer. Without federal funding, the organization would have to adapt. It would have to seek out other ways to serve low-income patients and support clinics in underserved areas. According to a Congressional Budget Office report, defunding Planned Parenthood would greatly reduce access to services for up to 630,000 people. This does not account for the people who would lose care if defunding caused the clinics to close. Some Medicaid patients would choose to pay for these services out of pocket, but some would forego care altogether. Politicians pushing defunding have claimed that there are other places these patients can go to for these services, such as federally qualified health centers, FQHCs. But many of these are not required to provide family planning services and are not required to serve low-income patients. Despite the political agenda of the Republican Party and their strong pro-life beliefs, this has developed into an ethical dilemma of taking away care for so many people who rely on it. There are multiple ethical practices being violated in the plan to defund Planned Parenthood, including that public health should advocate for or work for the empowerment of disenfranchised community members, ensuring that the basic resources and conditions necessary for health are accessible to all people in the community. Women rely on the services of Planned Parenthood clinics for medical needs beyond solely reproductive health services, such as cancer screenings, for example. It is known in the community as a safe place for people to go from all walks of life and all sexual orientations, and taking away this resource would be simply unethical. Who would shutting down Planned Parenthood health centers hurt the most? It's people of color, people living in rural areas, and people with low incomes. They represent the majority of Planned Parenthood's patients, and they already face unfair systematic barriers to accessing health care. If these patients are blocked from care, many would have nowhere else to go. In fact, 21% of counties have no safety net family planning alternative should their local Planned Parenthood health center close, and more than half of Planned Parenthood's health centers are located in rural and underserved communities. In In the weeks following the election, Planned Parenthood affiliates were flooded with new volunteers, and hundreds of thousands of individuals donated to the cause to make sure healthcare is protected. So, how do Americans feel now? They're scared that with politicians like Mike Pence in power, it could mean disaster for their healthcare access. So, what do the American people think? Overall, the American people overwhelmingly support Planned Parenthood. Even 48% of Donald Trump supporters said that they don't want to see Planned Parenthood defunded. I would like to finish with a quote from a woman by the name of Rebecca Grant. Despite the fact that a majority of Americans support reproductive rights, despite a weight of evidence proving that accessible family planning services leads to healthier, more economically vibrant communities, despite the mountain of barriers that low-income women, young women, and women of color face in accessing healthcare, conservative legislators have pledged to defund Planned Parenthood. It is a crusade, and all of the leadership of Planned Parenthood is ready to fight.